Hello, my name is Tanwir Fatima Katao, and I will be presenting about a public health practice in my community located in Toronto, Canada. However, to begin, I would like to define public health practice. According to the Centers for Disease Control and Prevention, also known as CDC, public health practice is the collective of people, programs, and processes that contribute to the operational effectiveness of public health activities at state, local, and tribal levels. So basically, this refers to the doing of public health and not the researching aspect of public health. The public health practice site in my community that I have chosen for this presentation is the first permanent supervised injection site located at 277 Victoria Street. Their mission is to provide a hygienic environment for drug users to inject pre-obtained drugs under the supervision of a nurse for safe practice. This is how a supervised injection site appears on the interior. So as we can see, there are several stations here, and at each station there is a nurse accompanying a patient. However, what I don't like about this setting is that patients are seated in very close proximity with one another, so which may make it more difficult for certain patients to seek additional services. So this here is an image of a patient injecting pre-obtained drugs using a needle into her arm. So out of the 10 essential public health services discussed in the textbook called Introduction to Public Health by Mary Jane Schneider, the supervised injection site fits in number 7 under the assurance category. This is because this site allows patients to have access to additional personal health services that they may require. This in turn has a positive impact on the public health of the community at large. In addition to supervised injection, which includes free sterile injection supplies, Toronto's supervised injection site offers additional services which include education on safer injection, overdose prevention and intervention, medical and counseling services, referral to drug treatment, housing, as well as income support. The supervised injection site also fits in number 3 under the policy development category, where members are informed, educated, and empowered about health issues. So according to contemporary international as well as Canadian research, supervised services benefit both individuals using the services as well as the community at large. So it benefits individuals by reducing the number of deaths caused by overdose, reducing the risk of contracting HIV and hepatitis through a needle, increasing the use of drug treatment services, connecting people with other health and social services, reducing the number of needles discarded publicly, as well as cost effectiveness. Toronto's Safe Injection Site claims that they are not promoting drug use but because of allowing Torontonians to have access to this facility. However, there is a downside. One negative outcome is that there may be an increase in crimes by drug users around the injection site facility. Toronto's mayor warns that there have been an increasing number of drug dealers that are visiting Toronto's injection site. He is calling for an increase in security for the safety of the Toronto community. A health advocate says that having safe injection sites in Toronto could, as a result, do more harm than good. Also, those who are against drug use may also have a problem with the safe injection sites because they don't want their own children to be exposed to such an environment. So to conclude, the supervised injection site located at 277 Victoria Street in Toronto is overall an effective public health program which aids in health promotion and disease prevention. However, there are still challenges that are faced and that need to be overcome. Thank you so much for listening to my presentation, and I look forward to your response, and thank you so much.